First, should a new Alzheimer's wonder drug be available on the NHS? 020 7862 2222 is the number. A drug that significantly slows cognitive decline has been approved for use in the early stages of Alzheimer's. Donanemab, it's called. It targets a known cause of the disease rather than just treating symptoms. It's been found to slow the worsening of thinking and memory by over 20% and reduce the decline of everyday activities by 40%. But Donanemab won't be available on the NHS after the spending watchdog concluded it doesn't offer value for money. NHS England says bringing in new dementia treatments like this could cost up to £1 billion a year. Dementia charities have said the decision is a frustrating setback. Russ, what do you think?
I can see what the charities are saying. It does send a message that maybe if you've got relatives with Alzheimer's or Alzheimer's yourself, that the UK might not be the place to test new drugs.
Mm-hmm. Your family affected by this?
Yes. My mother
have a picture, actually.
Passed away with Alzheimer's. There she is. 80th birthday, Norwegian Fjords cruise. She was fine then, and then from about the age of 83 over a 4-year period, awful.
Really?
Yeah. And obviously I get upset when I see that because she's no longer with us. So I have an interest in this subject. And when you look at the NHS, I don't want to go on a big rant, but there's so much wastage. And to his credit, Mr. Streeting is for my money, the only cabinet minister who's trying to grab the bull by the horns and change things a little bit. Some of his ideas are a bit mad, smartwatches for obesity, all this sort of, we're going to spend money on this, but we're not going to spend money on a possible treatment for Alzheimer's. You know, an organisation that's top-heavy in management and inefficiencies.
The cost. It's 25 grand a year, and it will... I think it might get you an extra 4 to 7 months, which isn't much. That's the problem, isn't it?
And that is the problem. Are we getting value for money? And that's what NICE have to do. It's their job, and it's an ugly job, isn't it? It's totally unattractive when we strip down the lives of our loved ones to a bill. But that is what NICE have to do in terms of ensuring that our NHS continue to grow. And we know from the stats that 85 and above, that figure is going to double over the next few years, 25 years. So, you know, and then our birth rate is falling. And we've got, you know, what are we talking about in terms of expense for this older age group? As we age, generally speaking, as a society, we're talking about the other age-related illnesses, osteoarthritis, obesity, diabetes. They cost the NHS billions every year. So is it right, actually, that NICE are looking towards dealing with those illnesses, age-related illnesses, and waiting until we see something come through from Alzheimer's?
And again, just on family matters, you've dealt with this in your family.
Yes, and dealing with it. So one family member who has sadly passed, she had vascular dementia, and one family member who is currently still alive. And it's so distressing from the family members. It's a very special birthday for the family member who is suffering. And our family are torn. Some are saying that they aren't going to go and visit her. Some are saying that they do want to go and visit her. And the ones who are saying that they don't want to go and visit her because she doesn't know. She doesn't know, she didn't recognise
I was lucky. My mum didn't know me. So I thank myself for that. But just to go back very quickly, Jeremy, value for money and the NHS, with respect, is a phrase for that organisation that at the moment doesn't exist, and it's about getting it right. And so this Labour government have got the right idea. But dementia isn't just for old people.
That is true.
You know, I mean, I remember going to see the specialist with my mother, and I said, is this going to be me? And she said, absolutely not. If by the age of 55 you had showed symptoms, then I could say yes.
Oh, really?
Yeah.
That's interesting.
It was very interesting.
55, yeah. OK, look, let's just take a look. I'm just going to go over to our wall here for a little bit more of the science on this, because it's so interesting where we are with the science. So let's just run this. And obviously the whole question is, what is it that makes Alzheimer's bring someone to their their knees like this? Well, if you go into the human body, you've got the genes. And Russ is referring to his mum. And it's not just genes, it's lifestyle and it's your environment as well. So those three things. And it may be that dementia, Alzheimer's, is actually starting maybe 20 years before the first symptom. 60-70% of cases are Alzheimer's, of dementia are Alzheimer's. So knowing about risk factors is crucial. Anything that's bad for your heart is bad for your brain. There's a good rule. So if you've got diabetes, that's not going to help. If you smoke, if you're obese, that's not going to help. We know that if you're drinking every night of the week, okay, that's not going to help either. We saw it. And if you have a lovely active lifestyle and a happy sentiment, like this lady, that does help. So we know that's kind of the basic stuff. But the scientists are doing more than that. They're looking into the brain to find the actual puzzle of the brain chemistry. Look, that brain is physically changing shape. No amount of crosswords will stop that happening. So what's going on? Okay, we come to something called beta amyloid. There it is, in the brain, naturally occurring. It's got a little bit of protein there, and that is called the amyloid beta precursor protein, because it's a precursor of the moment it splits up. In a healthy brain, Alzheimer's brain, they split up. And this bit of protein peels away. And in an Alzheimer's brain, it clusters. It forms a clump. And the clump starts to get involved with the neurons which are passing all the signals inside the brain. And this is where you get the problem. There's a second thing they discovered in the 80s called tau. Very much the same idea. It binds itself to the actual tube within which the neuron is sitting. So you've got the tau going inside and the beta amyloid going outside. And if you want a short way of saying it all, you can call them protein tangles. And sorting out inside the neurons and outside the neurons, sorting out the protein tangles is the job of this drug. Now, how does it work? You put it in through a drip into this gentleman, it goes to the brain. It prompts the immune cells to start clearing the amyloid plaque, the protein tangles we referred to, and it binds to them and breaks them up. That's how it works. The problem is the cost of it. Because if this gentleman, not only is it the cost of the drug, this gentleman may have to go into hospital once a month to have the drip attached to him. So it's at least £25,000 per year. It won't reverse it. It will just slow it down for maybe, if you're lucky, 7 months. Here's the coverage today. Let me just show you. Obviously, there's a lot of trumpeting of this in the headlines, but with this proviso that it looks like we can't afford it. So there we are. Donanemab could be licensed for use in the UK, but it has to provide value for money, which it doesn't at the moment. They talk about how it works. They talk about the amyloids that we've mentioned. And then they say, look, the drug and another new treatment called lecanemab have both been ruled out for treatment because of the cost. And they think it may even be £40,000 over 18 months. So there we go. That's it. It's not necessarily good news. The science is amazing, right?
Science.
The fact they can see these proteins and untangle them. Yeah. Cheryl in Powys, are you hopeful or disappointed by this?
Very disappointed. I think it's dreadful. Good morning.
Morning. Well, it's amazing what they're doing, isn't it?
The thing is that they're wasting money, Jeremy, on a lot of other things that could be put into this.
So, yeah, I see. So you're saying, like Russ is saying, if you took the money that's being wasted and you put it into this drug, you'd have a chance.
Yes.
Yeah.
Well, I would think so. The thing is that...
Yeah? You okay?
I can't hear you.
Don't worry. No, well, I stopped speaking because I was listening to you, but you fire away, Cheryl.
The thing is that the money that goes into loads of things, and the people of this country know that money is wasted around the world, in the Lords. There are so many things that you can say that we can take money from and put it into this project.
All right. Give me your best example in the NHS of where you'd stop wasting money.
Oh, a lot of things. Equipment. When I was nursing, we had our own sterilising unit every hospital. Mm-hmm. Now they're throwing them on the slag heap.
Oh, that's terrible.
Absolutely disgraceful.
And I don't mind if they want to sterilise a syringe and use it on me. I'm happy with that. I don't mind if it saves money. Thank you, Cheryl, very much. I wonder whether the big thought here is, you say, right, number one, if you go to the NHS, you sign a form that says this operation may go wrong, and if it goes wrong, it's on me. you do not have the option of coming back and suing for £5 million under any circumstances. No?
No,
Because you'd be out of a job.
Well, it's not that I would be out of a job, is that there is such a thing as medical negligence. There is such a thing as professionals
We
getting
can't
it
afford.
wrong.
We can't afford the insurances, the payouts. It's enormous.
And that is true. And do you know a classic example of wastage? A classic example of wastage is crutches. You see people with a broken leg, they're sent away with a crutch, and that crutch is never to be seen
Yeah, they
again.
won't take it back. Yeah.
Nobody ever takes it back.
I know,
It's
I know.
the trolley, isn't it? The supermarket trolley.
A lot of people who've broken their legs more than once have got 2 sets of crutches at home and they can't give them away. They could supposed to put them in landfill. Yeah. OK, anyway, back onto Alzheimer's and more calls after the break on whether actually, OK, £25,000 a year or £40,000 every 18 months, they still should pay it. Now, more calls on whether a new drug that targets a cause of Alzheimer's should be available on the NHS. 0207 862 2222. We talked about the protein tangles. That's what we got to remember. They're in our brain, possibly for 20 years before we have a symptom. That's the shocker. Hi, David in Norfolk. What would you like to say?
Yeah, good morning. I've listened with interest this morning. I'm really concerned because people think that dementia and Alzheimer's is just solely an older person's disease, which just simply isn't the case. I've worked with people that are in their 30s, 40s, and 50s with dementia and Alzheimer's.
And you're a dementia nurse, David, yeah?
That's correct. Yeah.
Is it? But I looked at the graph last night, and it's overwhelmingly patients over 60. Overwhelmingly.
It is overwhelmingly.
Yeah.
I totally agree. But it does affect a lot of younger people, and I think the cost side of things, it would be very, very, very simple to sort this problem out as far as the money side of things is concerned. I'm currently off work at the moment with bowel cancer, unfortunately.
Oh, I'm sorry.
So I get my prescriptions free. Now I'm currently on benefits because I'm not working, but I would be more than happy to pay £1.50, £2 towards my prescription. Now, if everybody in this country who was on benefits or even on pensions would pay £1.50 towards their prescriptions, it would solve the problem overnight.
I don't know whether they're going to wear. I don't know if they're going to wear that, because if you're on benefits, £1.50 is a lot.
Yeah.
And that's for each prescription as well. So you could end up paying £6 twice a week. David, thank you anyway, and I wish you well with your recovery. Thank you so much. Linda in Kent, this drug is amazing but expensive.
Yes, and quite honestly, I said to your researcher on the phone, I've told you before, I'm sure, that my mother was the youngest child of 18, and every one of them, bar one, had dementia.
Wow.
They've all gone now. My mum had dementia for at least 8 years and probably more. But no, I wouldn't take it. The doctor tells me that it's not necessarily hereditary, but I'm afraid I don't believe him. And I have my own plans for if he tells me I've got dementia. I'm not going to tell you what they are, but I'm sure you can guess.
I'm thinking it might involve Switzerland, yeah.
Well, no, I wouldn't go that far. I wouldn't be able to afford it. But I wouldn't take it if it was offered to me, because you say 7 months.
Yeah, it doesn't. And you know what? I think it's being overbilled because it doesn't cure it. It halts it. And I think, actually, funny enough, you could make a case to give it to younger patients.
Yes.
If somebody has dementia in their 30s, a young mum.
Yes.
I think that's completely different.
Yeah, so I don't even think it halts it, Jeremy. It slows down the process.
Yeah.
At its shortest for 4 months, at its longest for just 7 months. And you have to be on the treatment plan for at least 18 months, and then it has to stop. The actual the people who designed the drug say we don't want you on it for longer.
There
than
is an argument,
18 months.
which I'd like to just try on you, which is this: by buying it at 25 grand, we are rewarding them for their research. That's how it works. They take the money and they find a better drug that's cheaper. That's the deal here.
But
right?
To give you an idea, folks, 70,000 patients is the estimate of people in this country who would be, in a perfect world, offered this sort of drug.
70,000.
Right? A vial of this drug or similar, £537.54. And you've got to times that by 18 months. How many vials are they going to have a week? So you can see that this is an astronomical sum of money, isn't it?
Yeah.
Yeah, I'm trying to multiply 75 by 40, and I'm not getting very far. 103. I think it might be 3 billion.
Yeah, 2.8 billion.
Yeah.
something
Okay.
like
All right. Good. So there we are. 3 billion. At least we know that the price tag now. Thanks to our last caller, Linda. Bless you, Judith in Flintshire. Have you got this in your family as well?
Yeah, my dad had it back in 2013, and he lived with it for 6 years, and he's now passed away. So I'm worried that it might be hereditary in the family.
My understanding is it's more worrying if it's early onset. So if your mum or dad had it at the age of 45, that's more hereditary than the older sort. I mean, we're all getting it older because we're all living longer. That's the deal.
Yeah.
I guess if we all lived to be 100, half of us would get it, literally half of us.
Yeah, and this is the issue that our NHS in general is having to face, and we know that the Labour Party, they got Lord Darcy, didn't he, to do his research and conducted the report, and Lord Darcy informed us in this report that the NHS is currently at a critical state. And, that's not even talking about the 25 years I told you earlier about how we're going to see that double in size of 85-year-olds and above. So we need to think about how we are going to support ourselves as we learn to live longer.
Yeah, the NHS got played into the American election. I don't know if you remember when Obama was being challenged by probably, who was the one who had Sarah Palin as his running mate? John McCain. And Obama said we need to be more like the UK with their health system. And Sarah Palin said, in the UK, they have death panels. And everyone laughed and said, but actually, this is what she's talking about. She's talking about the panel of experts that says you cannot have this drug. That's what she called a death panel. Judith in Flintshire, because of your dad's experience, I'm guessing you would have wanted him to have the drug. Is that right?
Well, yeah, if it was available then. And not just my dad, other people as well as him.
Can you justify the cost of it?
I think it should be free on the NHS.
Yeah, but the cost to the NHS, I mean, that the NHS would have to pay.
Yeah, I think it should be available for everyone that's got dementia or Alzheimer's.
All right, thank you so much. Lisa in Leeds, do you think it should be available at this price?
Maybe not at this price. I think eventually it will become the norm like other drugs have. But there is a tremendous waste in the NHS at the moment, which could go towards the cost of this drug. I work in a care home, and every month they have what they call a medicine and cream turnaround, and all the medicines come in, and anything not used or even half used get thrown away. Some of them haven't even...
I can't bear it.
Jeremy,
this is
there
mad.
are bags and bags and bags and bags. And
It's crazy. I keep medications at home for years.
No, you can't do that.
Yeah.
I mean, there is a flip side to this. Should we get a drug for dementia and Alzheimer's that works and stops its onset, allows people to stay at home in their own homes that will be looked after by a carer or family and not need to go to a care home, which is creaking, that's a good thing.
Okay, thank you to all our callers, and later we'll be asking you...